Hello, today I'm going to be talking about a case study of a lady who had a diagnosis of osteoarthritis in her knee, and we're going to discuss how we've helped her with the aid of osteoneal injections into the knee. So hello and welcome. My name is Sarah Jane. I'm a clinical director here at Rehab Hub, MSK podiatrist, sports therapist and PhD candidate specialising in rheumatology. So the case study that I want to talk to you about today is a client that came to see us who was a yoga teacher, who still is a yoga teacher. Her name's Emily. She's 48 years old. Quite young to be getting problems with the knees. That is quite unusual for us to see. It's usually types of patients that we see with degenerative disease at the stage that Emily's was. They're usually into their 60s and 70s. But Emily admits herself that she has just overdone some certain things, a bit like myself. I had osteoarthritis in my left hip, and subsequently had a hip replacement. So she's pushed her body, let's just say. So anyway, her right knee was why she was coming in. She had been diagnosed, not with us, she'd been elsewhere and had a diagnosis of early osteoarthritis in the right knee. Now, the main issue that Emily was having was that her work primarily is as a yoga teacher, and it was massively affecting how she was then able to work and demonstrate and basically do the things that she enjoys doing, to the extent not only just her work, but even just things she enjoys hill walking, she enjoys going out walking, and it was getting to the point where she couldn't do that either. She was medication-wise, she was on quite a lot of medication, or quite heavy medication, really, considering that it's early arthritis, naproxen, so anti-inflammatory, and she was taking the maximum amount of codeine as well a day. So not a great combination. She was really at wit's end coming in, wasn't really sure what we could do. And amongst other things, because we did do Shockwave, we have provided her with a full rehab programme, but part of her management plan was an osteoneal injection. So what this does is it helps to provide, I suppose the way to think about it, and I'm probably slung saying this, but think about it like a WD-40 going into the joints. It's not quite as simple as that, but essentially what it's doing is it's providing that lubrication in the joints. If you imagine where you've got bone degeneration and the cartilage is worn away and that's an synovial joint, then what will happen is you'll get this friction. So I've got a knee over here. So if you are getting this friction, hers was on her medial side of her knee, so the inside bit of her knee. So these two bones are rubbing together, rubbing together, rubbing together, rubbing together. Every step she's taking, everything she's doing. So she's getting this build-up of inflammation. So simply what we do is we go in with the injection of Osteonel into the joint line. Hers is the medial aspect, and most people's knee degeneration, it usually starts from the immediately inside aspect of the knee. For most, not always, but that's generally what we see in clinic. And what it does is it provides this coating, this buffer. So I'll show you, this is Osteonel here. So this one is the standard Osteonel. This particular client, I don't have any in stock just yet, this particular client got Osteonel Plus, where she only needed one injection. You can do a course where you get 3 injections, it would be with this, and you would come weekly for an injection for 3 weeks, and that would be it. Now, generally, how long does it last for? You'll usually do a course of it once, possibly twice a year. That's it. So this is what the little cartridges look like. It's hyaluronic acid. So this one's out of date, so hence why I'm doing this. So you can see here, and it's just quite a sticky, viscous structure. So you can imagine that coating and lining the joint. Obviously, this one is one that it won't be getting used in a patient. It's there for demonstration purposes. So what that does is it in itself, just that being there will help reduce the need for naproxen, the need for inflammation, the need for that bone to be rubbing and causing that inflammatory process. So generally we find that patients get results quite quickly with that because it's not that rubbing, so they get a big reduction in pain immediately. But it's also helping in that synovial joint as well. So with Emily, it was her right knee. she came in, we decided with Emily that the Osanil Plus was the right course of action. I kind of alluded earlier there that sometimes people come in with this one and they get 1 injection or 3 injections. So why would we choose to do that? It depends on each individual patient. The price is much of a much. It's a full package if you're doing injection therapy. And it just depends on your particular needs. I've got a lady coming in next week and it'll be Osanil Plus she'll be getting as well because of her circumstances. So it's not the same for everybody. It does just depend. So osteoarthritis, she had 1 injection of Osanil Plus. We then followed Emily up 2 weeks after, and she had reported back that within a few hours of the injection, she said it was a wee bit sore around where the injection was, which is dead normal after that. Post-injection, you've had the injection, just feels sensitive. If you ever had one in your arm, just feels a wee bit sensitive. And then after that, she said it was fine, just for that kind of 24 hours, that I could just feel that something had been there. And then she said she started to feel slight improvement almost up. It just kind of built up. By 2 weeks, she was feeling the benefits of it, but she was still kind of struggling a little bit. Then when we checked in 1 month later, Emily was like, my pain is completely gone. And what was phenomenal was that she is now off her naproxen fully. She's not having to take them at all, not even at night. She's fully off them, and she's off all pain medication now, considering she was like taking the maximum amount of codeine, that which is not great. There's so many side effects with that. It's not brilliant to be on that. She's fully off all medication. So that for her is life-changing. Now, we've not fixed Emily's knee. We're not going to fix it. It might be that down the line, Emily may need a knee replacement, and that's not for me to say. It might be a choice that she chooses to do later. She's quite young for a knee replacement at 48. But what we're doing is we're allowing Emily the ability to be able to do what she enjoys for a longer period of time and keep her on her feet, keep her active, keep her healthy, and that is life-changing. We're not fixing the osteoarthritis, we are reducing that pain and helping her manage her condition. Now, I just want to be clear as well, within this management plan for Emily, it wasn't just injection therapy, and it's really important that I get that across in this, because if I had to say that you just come in and you get an injection and that's all that we would do to you, really we're giving you a disservice there, because there's other things to consider around, one, why you're getting that degeneration in the first place. So with Emily, what is it she's doing in her yoga practice that's contributing to that? So actually a lot of guidance and support for her in her biomechanics and actually her movement patterns. She needed a lot of that to really, really hone in on how she's utilising her body and putting excess forces through it. So Emily needed a bit of support with that. And yoga teachers, golly, that's a bit of a sweeping statement, but just because you're a teacher, regardless of what you're teaching, doesn't mean to say that your form or your technique is perfect. So Emily needed a good bit of support with that, and that will help her as well. We also wanted to have Emily not just focusing on yoga. We really needed to get her to strengthen through her legs and her hips, because when we did her gait assessment, so she had a full assessment with her run walk 3D system, we found that Emily was from the lower limb, she had this she was in this extended pronated position through her foot, which is fine, but for her she was loading, and this was putting excess force. So if you imagine the foot's rolling in and then she's getting this extra force going into that medial aspect of the knee. And then also what she was doing, she was hyperextending through the knees. So as she was moving, we had this hyperextension primarily through the right knee. So there was a few different things here that she needed help with as well. And also when we brought it up into the thighs and the hips, there was lack of stability and strength there as well. So a full movement pattern and strength training program was also part of Emily's plan. So it wasn't just a case of you get your injection and that's it. So it's managing all of that. The other thing with Emily that we've discussed, we've not done it yet, is possibly when she's going out hill walking. So she probably won't need this for day to day, but for her, she's probably going to need a support and orthotic for her walking shoes, because of how she's moving and the forces that she's putting through her joints. it's more than likely that down the line, we're kind of looking at that just now, she despises the thought of that. But we've got to look at what is it we're trying to do. We're trying to offload this knee. We're trying to buy you more time. We're trying to strengthen everything else up. And if we can do that with an orthotic, then why not look at that? It wouldn't be something she's going to need day in, day out, but certainly if she's going a big long walk, that will absolutely be something that I want to discuss with her. There's various things that we can do with that, but that's for another video. So that's Emily, 48, Austenelle injection. She's got Austenelle plus one's price. What's the price for an injection? So for the injection, so just the injection, it's £250. That gives you your initial consultation, your injection, your 2-week follow-up, and your month follow-up. Your follow-ups can be in person if that suits you. I've got a patient coming down from Perth next week. So for her, she's like, can I just do the consultations over the phone? That's absolutely fine. You can do it, but we like to have those check-ins, reassurance, questions. It's a vital part of that process. So that's all included in your package. So for your Austenelle ones, it is £250. If you were doing the 3 injections, 1 per week, if that was where you were going, it's slightly more expensive. I don't have the price right in front of me, but it's maybe somewhere around £340 for that full package as well. And that includes your consultation, your injection each week for 3 weeks, and then all your follow-ups as well. So I hope that's been of interest. If you've got any questions on joint injections, please don't hesitate to reach out. I'll do another video on tendon injections because we do use Austenelle tendon, which if many of you may know that I ruptured my Achilles tendon. I'm an absolute walking disaster when it comes to injuries. Hip replacement and Achilles tendon rupture. Oh, I like to have patient empathy, so I say. But basically, follow this because my other Achilles has been giving me a bit of jip, so I will be having some tendon, Austenelle tendon injection into my left Achilles, just keeping it nice and happy because it's grumbling at the minute, and let's just say I don't want any problems. So I'll do another video on tendon injections, primarily for the Achilles tendon, not steroids. We'll go into that in the other video. This is Austenelle tendon injections. Again, if you have any questions, comment on this video. Further details on our injection therapies, I've put a link with this video, so wherever you're watching this video, there'll be a link to our website. You can go and have a read, watch some of the videos, read some of the blogs. We've got a whole knowledge centre where we answer lots and lots of questions that our patients send us. So if you have any questions, do fire them over. We always do our best to answer them. Thanks for listening, and we'll maybe see you soon.